Hello everyone, welcome back to my channel. It's been a while since I have posted anything on this channel. It's complicated to post on three different channels. It's hard to just focus on one channel, so sometimes I lack on one channel and the other one is doing well, and then I forget the other channel and stuff like that. But anyway, for this video, I wanted to talk about, you know, mental health is I want to implement mental health on my channel because I feel like mental health, while having a neuromuscular disability like muscular dystrophy, you can go through, mental health challenges and stuff like that. And one of those mental health problems that you might run into, you have some sort of neuromuscular disease or any disability, or just, you know, or don't even have a disability in general, you can still deal with it, you know, which is depression. For me, in my opinion, I feel like depression and muscular dystrophy, and neuromuscular disease, could be a ticking bomb because a neuromuscular disease like muscular dystrophy is a progressive disability. One day you're going to be able to do this, the next you won't. You're slowly going to start getting weaker and not being able to do a lot of things, which can cause depression in someone with a disability or just in general without even if you don't have a disability, it can still cause depression. But when you have a disability, you're more likely to experience depression at some point in your life and stuff. So that's why for this video I thought I'd talk about a little bit about depression, because I feel like depression and muscular dystrophy is like you combine those two things and can be a very dangerous situation for an individual living with muscular dystrophy, or like I say in general, not living with muscular dystrophy. That's why I want to implement, because I feel like mental health and having a disability, you combine those two things and can be a very dangerous combination, in my opinion. I went through isolation, which is some sort of mental health, which I'll talk about a little bit more about in a different video. And I want to focus a lot on mental health besides just do my regular videos about, topics about muscular dystrophy. I feel like depression is a topic that's connected somehow with muscular dystrophy, in my opinion, or any disability, or just in general. You know what I mean? I found this. What is depression? What's we all know depression is like a mental health disease, that affects numerous people and stuff. But what is like the proper definition? It says depression is a mood disorder that causes an persistent feeling of sadness and loss of interest, also called major depressive disorder or clinical depression. It affects how you feel, think, and behave. You can lead to a variety of emotional and physical problems. You may have trouble doing normal day-to-day activities, something you may feel as if life isn't worth living. Life isn't worth living. That can be, you know, someone with a disability might feel like, what's the point of living? It's like this, like muscular dystrophy is taking everything away from me. So what's the point of living? I feel isolated, I feel depressed. People with disability can be like, what's there to live? This disability is basically killing me. It's gonna kill me at some point. So what's the point of living? So that's why I meant like muscular dystrophy and depression can actually be a life threatening situation for any individual, but more likely for someone with a disability. More than just about the blue, depression is a weakness, and you can simply snap out of it. Depression may require long-term treatment, but don't get the correct. Most people with depression feel better with medication, psychotherapy, or both. So that's what it is. Then let's go to the symptoms. I mean, it's hard for me. I feel like, in my opinion, it's hard to tell when someone's depressed. 'Cause you might see like a friend, a family member, being like, you see them. I mean, you interact with them. You see them. Oh, there's nothing wrong with that person. But sometimes, people might look like they're not going through anything in life. They might look like they're fine, but deeply inside, we can't read minds. If we could, like, probably there wouldn't be a lot of people, suicides due to depression and all this. But always like check up on people. You see something's wrong with them. I mean, I know it's hard to tell, but always check up on them and stuff. Even a simple message, simple, text, whatever, how you communicate. Although depression may occur only once during your life, people typically have multiple episodes during these episodes. Symptoms occur most of the day, nearly every day, and may include feeling of sadness, tearfulness, impotence, or hopelessness, anger, outbursts, irritability, frustration, even in small matters, loss of interest, pleasure, most of all normal activities such as, you know, hobbies or sports. So, being intimate with your partner. That's what it says right here. I'm not, that's what it said. That's what it says right here in the symptoms category. I don't know why they have that on there. Honestly, I don't know what does that have to do with anything. But anyway, it says sleep distribution, including somnia, sleeping too much, tiredness, and lack of energy. So even small tasks take extra effort. Reduce appetite, weight loss, or increased craving for food and weight gain, anxiety, irritation, or restlessness, slow thinking, speaking of body movements, feeling of worsening or guilt, focusing on past failure or self-blame, trouble thinking, making decisions, remembering frequent thought of death, suicidal thoughts, suicide attempts, suicide, unexplained physical problems such as back pain or headaches. And it says for many people with depression, they usually are several enough to cause noticeable problems in day-to-day activities such as work, school, social activities, or relationship with others. But sometimes, like, even though you might have a coworker, a friend at school, or your significant other, going through it, even though you spend time with them, with these people, in your life, sometimes it's hard to tell when there's something wrong with them. Some people may feel genuinely miserable or unhappy without really knowing why. Depression symptoms in children and teens. Common signs of depression in children and teens are similar to those of adults, but there can be some differences. In younger children, symptoms of depression may include sadness, irritability, clickiness, worry, aches, and pain for to go to school or being underweight. In teens, it may include sadness, irritability, feeling negative and worthless, anger, poor performance, poor attendance at school, feeling misunderstood, stupid, insensitive, using recreational drugs or alcohol, eating or sleeping too much, self-harm, loss of interest in normal activity, and avoidance of social interaction. I mean, all these probably can affect someone with a disability, especially if they're a good student and stuff, grades go down. They're not doing their usual activities. Depression and symptoms in older adults. Let's see the difference. Depression is not normal part of growing older. It should never be taken lightly. Unfortunately, depression often goes underdiagnosed and untreated in older adults, and they may feel reclined to seek out. Symptoms of depression may be different or less obvious in older adults, such memory difficulties or personality change, physical aches or pain, fatigue, loss of appetite, sleep problems, loss in interest, and you know not caused by medical condition or medication, often wanting to stay at home rather than going out to social or do new things through the social thinking or feeling, especially in older men. And it says when to see a doctor. That's a good question, because sometimes you might feel like you'll be fine, you're just going to having a bad day or just going through some personal stuff, and once you get past that, once you get past whatever you're going through, you might feel like you don't need a doctor and stuff, but it can be hard, like knowing when you do need to seek help or when it's like it's just a dark time in your life, but it's gonna get better once you get out of that problem and stuff. But sometimes it just doesn't get better, you know? If you feel to make an appointment to see your doctor or mental health professional as soon as you can, if you reclaim to seek treatment, talk to a friend or loved one, any health professional, faith leader, or someone else you trust, you know, it's always nice to talk to someone who you feel comfortable with, like it says. When to get emergency help? Yeah, this is a good question right here. When to get emergency help? Because sometimes you might already be seeing a therapist or like you're talking to a friend, a family member that you trust, you know, about your issues, you know, and whatever you're doing, it's helping, you know. But sometimes you can have a mental health breakdown, you know, which is normal, you know, to happen in some people. So let's see what can you do, like when to get that emergency help if you ever need it. If you think you may hurt yourself or attempt to call 911 in the US or your local emergency number immediately, obviously. Also consider three options you're having suicidal thoughts. Call your doctor or mental professional. Contact suicide hotline. In the U.S., call or text 988 to reach the 988 suicide crisis line. Available 24 hours a day, 7 days a week, or use the lifeline chat service or free and confidential. Then if you're a U.S. veteran, you know, salute to all the U.S. veterans out there. U.S. veteran service member who are in call 8988 and then press 1 for veteran Chrysler or text 838 255 or chat online. The Suicide Chrysler Lifeline in the U.S. has a Spanish language phone line at 188 628 9454 toll free number. Then it says if you're having an emergency, you can also reach out to a close friend or loved one. But I feel like we're reaching out to a friend or a loved one for probably when it's like it is an emergency, but it's not like a life or death emergency. But if it is, I feel like would be best if you know, reach out to those suicide hotlines. Constant minister, spiritual leader, someone else in your faith community. Then instead of you have a loved one who is in danger of suicide or has made suicide attempt, make sure someone stays with that person. Yep, if you see signs of, you know, your family member, you know, that has thought of suicide, I feel like you have to be more conscious with that person, you know, cautious because, you know, you never know in a split second, you know, she or he can attempt, you know, to take their own life, you know and stuff, call 911 or your local emergency number immediately. Or if you think you can do so safely, take the person to the nearest hospital and emergency room. Then we have a little bit more. Then it says after emergency, let me see. Causes. Let's see. It also knows exactly it's not exactly know what causes depression. With many mental disorders, various factors may be involved, such as biological differences. People with depression people have physical charge changes in their brains. The significance of their changes is still uncertain. I mentioned how pinpoint causes, and it says brain chemistry. Neurotransmitters are naturally occurring brain can likely play a role in depression. Recent research indicates that changes in the function and effect of these neurotransmitters and how they interact with neural circuits involved in maintaining mood stability may play some role in depression in its treatment. And as hormones changes in the body balance, hormones may be involved in causing or triggering depression. Hormones change can result with pregnancy during the weeks or month after delivery, postpartum, and from thyroid problems, menopause, or a number of other conditions, inherited traits. Depression is more common in people whose relatives also have this condition. Research trying to find genes that may be involved in causing depression. Then let's talk about the risk factors of having depression. Depression often begins in their teens, 20 or 30, but it can happen at any age. Yes, it can happen at any age, but you're more likely it to happen, you know, at any point in your life when you have a physical or a mental disability, you know. More women than men are diagnosed with depression, but this may be due in part because women are more likely to seek treatment. Factors that seem to increase the risk of developing or triggering depression include Certain personality traits such as low self-esteem, being too dependent, self-critical, or pessimistic. Low self-esteem can affect someone with a disability. You might feel like you can't do anything. You let your disability affect you, which is normal to happen. So traumatic or stressful, such as physical or sexual abuse, the death or loss of a loved one, a difficult relation or financial problem, or having a disability as well. Blood relatives with history of depression, bipolar disorder, alcoholism, and suicide, being, it says being lesbian, gay, bisexual, trans, or having variation in the dominant genital organ that include male or female, intersex in an unsupported situation, or like I say, having a medical disability, history of other mental health such as anxiety disorder, eating disorder, post-traumatic stress disorder, so abuse of alcohol, recreational drugs, here, chronic, including cancer, stroke, chronic pain, or heart disease, like I mentioned, certain meds such as some high blood pressure medication or sleeping book. Talk to your doctor before stopping any medication. Always talk to your doctor before you decide to stop taking whatever medication you're taking. Depression is serious, so it can take a toll on you and your family. Depression gets worse if it's is intuitive result in emotion, behavior, and health problems that affect every area of your life. Example of complications associated with depression include excess weight or obsessive weight can lead to heart disease, diabetes, pain, or physical illness, alcohol or drug misuse, anxiety, panic disorder, social phobia, family conflicts, relationship, difficult work, school problem, social isolation, suicidal feeling, suicidal attempts or suicidal self-mutilation such as cutting, premature death from a medical condition. And then this is prevention. Let's see what there's no sure way to prevent it. However, this strategy may help. Take steps to control stress, to increase your resistance and boost your self-esteem. Reach out to family and friends, especially in times of crisis, to help you with a rough spell. Get treatment at the early sign of a problem to help prevent depression from worsening. To help prevent consider getting long-term maintenance treatment to help prevent a relapse of the symptoms. So there you go. There's you know a little bit of information about depression and stuff, but for this video I thought I'd just talk about depression in general. I mean, I'll try to find like some sort of article talking about depression and muscular dystrophy, but I thought I'll start with depression in general, because like I said, having a neuromuscular disease or any type of disability, it can really affect your self-esteem. It can really help affect your mental health. Depression is one of the causes. When you have a disability, most people go through depression at some point of their life. Especially when you have muscular dystrophy, you slowly gonna get worse and worse. You're slowly, one day you walk and the next day you don't, and stuff like that. And the next day you use a wheelchair, the next day not sure what else happened. You get weaker and weaker, and something that can lead to depression when you have some sort of disability. So I thought I'd make a video talking about a little bit about depression and stuff. But I'm gonna try finding an article talking about depression and muscular dystrophy. Let's see if I can. What can I find in that category? Combination of both. Mental health and you know, the disability you were diagnosed with when you were, born and stuff. So anyway, so stay tuned for that video. And anyway, that's it for this video. Thank you for watching. Don't forget to like, comment, subscribe, and hit that notification button. Until next time.
I can feel the blood creeping up from the heathens. Got will, got fight, got pride.